I'm going to give you a little history on the on-site clinic here at Howell. We started in the summer of 2014. Many of you guys that have been here a while, you know where the first aid room is at. That was actually our clinic in the very beginning. One of the first major upgrades that we actually noticed as our patient population increased was the curtain that divided myself and the exam table, so we would have a little privacy with each of you that came to see me. And now, fast forward 4 years, we have an updated clinic with 3 private exam rooms. We have an integrated waiting room. We have lab capabilities, a dedicated radiology suite. We have been fortunate enough to add a 3rd staff member to help with the increased population. When we first started in 2014, we averaged 8 to 12 people a day. And now we've grown to where we average around 29 a day. The Xray capabilities that we have on site here at the clinic actually speed up any kind of visit that you may have to endure if we weren't here, because we can actually diagnose a non-fracture versus a fracture in-house, and if it's a non-fracture, that saves 3 or 4 hours waiting at a local emergency room or more, depends on where you go, and the headache and heartache that goes around with being exposed to who knows what kind of bacteria and viruses that are floating in the air. We can do it here within 30 minutes. We can have an ACE wrap and an ice pack on you, and we can have instructions to get you back to work as quickly as possible. It's also a wonderful tool to help decrease the overprescribing of antibiotics. For example, if you come in with a cough, we do a chest x-ray and we determine right there if it's bronchitis, if it's pneumonia, or is it a simple cough due to drainage. In the near future, laboratory upgrades are coming that will give us 2 new pieces of lab equipment to enhance what we can already do in-house. These 2 new pieces of equipment will actually allow us to do blood counts, electrolyte panels, kidney function tests, and liver enzymes within 12 minutes right here in-house. That's going to decrease any wait times for sickness. It's going to decrease wait times if we're worried about dehydration with the electrolyte profile, and it's going to help those that actually have to have kidney and liver tests periodically for an outside physician. We've also continued to make improvements at the Marathon Clinic. Acuity level of the patients that we're seeing has increased. Therefore, not only do we staff the clinic with a nurse practitioner, we also have a registered nurse on board to handle anything that comes through the door. Some of the new equipment that Marathon is using mirrors what we have up here at Howell to be able to do on-site lab testing with urine, strep, flu, different things of that nature. As team members steadily increase their utilization of the clinic down at Marathon, we will continue to make improvements with the capabilities that are offered at the clinic. The collaboration of North DeKalb Primary Care and Environmental Solutions Group, bringing the on-site clinics to both Howell and Marathon, has improved lives greatly due to the fact that the ease and convenience of making appointments, getting to the appointments, and the speed at which the appointments happen actually encourage people to take control of their own health. For example, we can catch diabetes before it becomes a problem. We can catch hypertension as it steadily is on the rise and medicate it appropriately before we have a stroke and a heart attack. These are just some of the many ways that ESG is helping to improve lives.